in order for us to make adjustments to that formula, we will be working, we would need to work with, as we are right now, with provinces and territories.
Canada's doctors say the federal government needs to step in and shift vaccines to COVID hotspots, provide paid sick leave, and move medical resources to where they're needed most. But the Prime Minister and Intergovernmental Affairs Minister say they don't have the power to do that. The provinces do.
I know that this kind of conversation is currently underway, but I don't believe that we are on the cusp of receiving a consensus from provincial premiers throughout the country to change the sharing formula that is used, and that was accepted by all premiers and that was proposed by premiers last December.
And it doesn't seem the provinces and territories are interested in sharing. Alberta has refused Ontario's request for ICU nurses. Ontario has added more intensive care beds, but there's not enough staff to work them. Nova Scotia's premier saying he's against changing the vaccine distribution formula, even as the Canadian Medical Association warns the pandemic has passed a critical point and changes are needed now. In a statement, CMA President Dr. Ann Collins says, "We are one country and it's time we started acting as one by deploying resources where they are most needed. If we can't achieve this through voluntary cooperation, then more and stronger measures might be needed." Justin Trudeau has repeatedly said Canada's federal model of government means he can't force provinces to act. But the PM does have a powerful tool he's refused to use, the Emergencies Act, which would give the federal government sweeping powers in a national crisis. But as of now, Ottawa says that's not on the table.
The government's cabinet isn't considering this kind of eventuality right now, and premiers have also not asked us to invoke this legal tool.
Meanwhile, there is an update on the vaccine front. Canada has signed a new deal with Pfizer for an extra 8 million doses to start arriving in May. And the Johnson & Johnson vaccine now has a delivery schedule with the first shipment to arrive in the last week of April. In Ottawa, Xiaoli Li, City News.